Hello, this is Diagnosis Bona Curatio Bona, and today we will talk about diabetes mellitus, type 1, type 2, prediabetes, gestational diabetes, and also complications. So let's start talking about prediabetes. This is condition where the glucose in the blood is elevated above the normal range, but doesn't satisfy the type 2 diagnostic criteria. So it's a 6.1 to 6.9. A diagnosis of prediabetes, it doesn't mean that you have to start medication, but it increases the urgency of promoting lifestyle changes such as weight reduction and increased physical activity. So gestational diabetes, it's when there is a new onset of abnormal glucose tolerance during pregnancy. They have two major risks. The first is fetal macrosomia. Women with gestational diabetes are known to have larger babies, and this creates an increased risk of complications of delivery, including shoulder dystocia and cesarean delivery. The second risk is of the eventual development of rare diabetes. 50% of women with gestational diabetes will go on to develop overdiabetes within the next 20 years. And also, diabetes mellitus affect a lot of organs and systems. And to remember what organs and problems affected by diabetes, there is a mnemonic: knives, kidney, nerves, infections, vessels, eyes and skin. Kidney, it's a diabetic nephropathy. Nerves, it's a sensorimotor neuropathy and autonomic nerve damage. And also vessels, so it's could be a coronary heart disease and some brain cerebrovascular disease. Also peripheral vascular disease of extremities. Eyes, and it leads to cataract, glaucoma and diabetic retinopathy. And also skin, and one of these conditions is called diabetic dermatopathy lesions. And also infections, from nail fungal infections up to cerebral abscesses. Diabetes mellitus, it's a group of metabolic disorders characterized by high blood sugar level over a prolonged period of time. And the classic symptoms of type 1 diabetes mellitus are polyuria, polydipsia, polyphagia, fatigue, and loss of weight. In type 2 diabetes mellitus, patients have insulin resistance, and it's related to obesity rather than loss of weight. And they usually have some complications when they get older, but at first they could be for a long time just asymptomatic. So diagnosis for symptomatic patients: fasting venous blood glucose, and it's greater than 7.0 millimole per liter, or random VBG, it's greater than 11.1, or hemoglobin A1C greater than 6.5%. If asymptomatic, at least two separate elevated values, either fasting 2 or more hours postprandial blood glucose level. And treatment for type 1 insulin, and for type 2 diet and exercise. And if it doesn't work, metformin. If it doesn't work again, add to metformin GLP-1 agonist or CGLT2 inhibitor. If again it doesn't work, insulin. And when you treat patients with type 1 diabetes, you can find that there are a lot of kinds of insulin like this. So there is some of them short and some long-acting insulin. And why we have so many kinds of insulin? It's because there's basal insulin level and prandial insulin level. So this patient have to take at least 3 bolus insulin before they go to eat, and also usually 1 time per day basal insulin, which is long acting. So let's talk about complications of diabetes mellitus. It's a hypoglycemia. It is more common with treated type 1 diabetes, but can occur in type 2 diabetes patients. On oral hypoglycemic drugs, it's usually sulfonylureas, and it occurs when blood glucose level falls to less than 3 millimole per liter, and clinical features are sweating, tremor, palpitation, hunger, and perioral paresthesia. And also it could be rapid loss of consciousness, and it's usually without warning. And the most severe cases, it could be coma, stuporose, comatose, or strange behavior. And treatment for mild cases, you can give just some sweet food. It's maybe sugar, chocolate, jelly, everything. And in severe cases, of course, if it's a patient is unconscious, so it's will be glucose IV. So next is diabetic ketoacidosis. It's a life-threatening condition, and it requires intensive management. And it usually occurs during some illnesses when insulin is emitted just this patient. And of course it also can be occur in type 2 diabetes mellitus too. Diabetic ketoacidosis, it's when blood glucose greater than 300. There is also ketonemia and acidosis. Clinical features are polyuria, polydipsia, drowsiness, vomiting, and abdominal pain. Treatment, it's of course it's a urgent situation, so arrange urgent hospital admission. Also give 10 units rapid acting insulin intramuscular and IV infusion of normal saline. Next is hyperosmolar hyperglycemia, and it's hyperglycemia and dehydration without ketoacidosis. And clinical features are polyuria, polydipsia, severe dehydration, and impaired level of consciousness. And this level of consciousness correlates with plasma osmolarity. Coma is usually associated with an osmolarity greater than 404 millimole per liter. And for this condition, respiration is usually normal. So diagnosis, and you can find hyperglycemia and high plasma osmolarity. Treatment is IV fluids and insulin. Okay, next is lactic acidosis. It's when pH less than or equal to 7.55 and lactatemia greater than 2 millimole per liter with a partial pressure of carbon dioxide less than or equal to 42 mm mercury. Clinical features are hyperventilation, so they're like air hunger and confusion. Diagnosis, it's a blood acidosis, low bicarbonate and high serum lactate, also absent serum ketones and a large anion gap. And treatment is rehydration and alkalinization with IV sodium bicarbonate. And the prognosis of patients depends on the cause and level of lactate. Very high levels of lactate during shock and are associated with high mortality rate. Okay, so that's all, and thank you very much for watching. Next time we will sort out some issues with thyroid gland. And so see you next time. Bye bye.